Florida Medical Association, helping physicians practice medicine.
Welcome to the Medicine Curated podcast. I'm your host, Tim Stapleton, CEO of the Florida Medical Association. I'm excited to welcome today's guest, but before I mention his name, let me tell you about this amazing physician. He's a graduate of Yale University, where he earned a Bachelor of Science in Molecular, Cellular, and Developmental Biology. He earned his medical degree from the University of Miami's Miller School of Medicine. Prior to medical school, he earned a master's degree in public health and worked in that field. He joined the faculty in the Division of Infectious Diseases after completing his residency in internal medicine at Jackson Memorial Hospital. He is now an assistant professor in the Department of Medicine at the University of Miami Miller School of Medicine. He's board certified in internal medicine. He is the principal investigator of the University of Miami's Harm Reduction Research Group, which houses the Idea Exchange, Miami's pilot syringe access program. His research interests include behavioral interventions and innovative approaches to HIV prevention. He has received numerous honors, including the Starbucks Upstander, Miami Chamber of Commerce Healthcare Hero, and SAVE Champion of Equality. He served for several years as a member of the Florida Medical Association's Board of Governors, representing resident physicians and young physicians. So he served two terms. It's a pleasure to have Dr. Hansel Tookes joining us today. Welcome, my friend. Good to see you.
Good to see you, Tim. I wish I were still on the board with you, but as you know, I'm a new father in the middle of a pandemic, so things are complicated, to say the least.
Congratulations to you. That's a life-changing moment, and I'm glad that you're getting to enjoy being a father. It's the best thing in the world. So, congratulations. Before we talk about your current work, tell us about why you decided to become a physician, and who were the people that motivated you along the way to pursue medicine.
You know, when I'm in my office, I'm actually at home right now, but when I'm in my office, there's a very large picture of my grandmother, who was a nurse in Miami. She was one of the first Black nurses in our city. She used to work on what were called the colored wards of Jackson Memorial Hospital, where I'm now an attending. And as a young kid, I used to go to work with her. I used to volunteer with her, feeding people who were homeless. She really instilled in me this sense of duty to public health and to society. And so I've been so honored to carry her torch in our city as a physician. And she really, I think it was when we placed the needle exchange right next to the Sisters, where we used to cook for the homeless people on 17th Street, that I really realized the profound influence she had over my life. So I'm very, very proud to carry the torch for my grandmother, and I absolutely love my job as a physician.
Well, that's an amazing story, and there is a lot of symmetry there. I love it. So tell us about your journey, which led to the creation of Florida's first pilot syringe access program. How did you get this idea? What inspired you, and what were the steps along the way to making it a reality?
Well, Tim, you were there for all of those steps, and I'll give a preview. I'm glad to say it's no longer pilot status that we operate in, but when I was a public health student before medical school, for my capstone project, the final project of a public health student's master's, we do a project. And what I did was I counted the number of syringes improperly discarded on the streets of Miami. And without syringe exchange, no place for people to dispose of their syringes. Obviously, there was a very, very high density of syringes on our streets. Now, that story, that paper, when it was published when I was a medical student, was very, very translatable to the lay press and to the public. The public understood that without a place for people to put their syringes, we weren't going to be able to decrease the amount of syringe litter on the streets of our city. On top of that, Miami has the highest rate of HIV in the entire country. And we know that syringe exchange is one of the bread and butter public health preventative interventions that we can use. So, as the last decade, as the years went by in the last decade, we know that there was a transition from prescription opioid epidemic to a street heroin epidemic. And a lot of that came from misguided but well-intentioned action from the legislature. When they closed the pill mills and implemented the prescription drug monitoring program, they shrunk supply of opioids without addressing demand. The demand was still there. And so people were driven to using street drugs. So then they were using heroin. They were using counterfeit pills, then heroin, and then the transition in the mid last decade, around 2015-16, to fentanyl. We had a surge in opioids in a surge in opioid overdose deaths in our community. So it was very timely that we were pushing for needle exchange in our community. You want to hear the story of how we got it done?
Yeah, please. Let's go into it.
I gave talks at the university and other places about the study that I had conducted and the context of the surging overdose deaths and the high rate of HIV. And one of my colleagues, Marek Hirsch, who's also a member of the Florida Medical Association, came to me and said, how are we going to get needle exchange in this state? And I did not know. And he said, we need to go to the Florida Medical Association. And this is just me speaking during a lunchtime talk. I never thought anything would come of it. But we were able to work through the medical student section, the medical students in this state from all of the medical schools, to pass a resolution in the House of Medicine, the House of Delegates, the summer meeting. Back in 2012, we were able to pass a resolution that asked the Florida Medical Association to actually seek legislation to make needle exchange legal in our state. So really the FMA was in anticipatory mode. It was our organization understood the importance of HIV prevention and overdose prevention, I think, before the entire state realized that we were in a really tragic place in terms of the overdose crisis. So after we passed that resolution, worked with the legislative affairs team at the Florida Medical Association over 4 sessions, and we were able to finally pass the pilot legislation in order to authorize our program here in Miami in 2016.
So initially, I remember going back. I can't believe it's been that long. It's been almost, I guess, 10 years, 9 years, I guess. But initially, I know some of the roadblocks really came from the law enforcement community, and they were very opposed to this initiative. But many over time have changed their position, and now you actually have law enforcement, particularly in your community in Miami-Dade, who are very supportive of this concept. So how did you go about convincing them?
So we've been very fortunate in Miami. I think that in the first year of operations, when we opened the pilot, we opened on World AIDS Day in 2016. And we didn't speak to law enforcement, particularly in the community, the officers that were patrolling the areas where we had both our walk-up site as well as our mobile sites. And we had a difficult time getting the local law enforcement really on board. But what we did was we started to host officers at the exchange. The state attorney, Ms. Catherine Fernandez-Rundle, facilitated these introductions, and we started to host law enforcement at the exchange, show them what we did and the importance in terms of overdose prevention, preventing needle sticks to law enforcement, because we give sharps containers, the change in the law. Somebody who is about to get patted down in Miami-Dade County can say, listen, I have a syringe on me, don't pat, because it's not illegal here. So once we were able to show the law enforcement officers what we did, there was I cannot even tell you. They're some of our biggest supporters here in Miami. As you know, when we were trying to pass the expansion bill, we had further challenges from law enforcement statewide. And our chief, Chief Colina, was very, very vocal about how he felt that this program had done a lot of good in Miami-Dade County, particularly as a pathway to enter treatment, preventing needle sticks amongst law enforcement officers, and lowering the overdose rate in Miami. We are the only county where the overdose rate started to go down after we started distributing naloxone, the nasal spray that prevents an overdose.
Well, that's great, and that's a good segue to the next question, which is, now that the program has been established and you have a track record, share some of the data with us. Share the success story that I know you're anxious to tell us about.
Absolutely. So in early 2017, in partnership with the Florida Department of Children's and Families, we started to give naloxone, the life-saving medication, without a prescription. We were the first street-level distribution of this drug in the state, giving it to people who use drugs in order to have them as the first responders to overdose. And we have distributed almost 3,000 boxes of naloxone, and over half of those have been self-reported to our program that they have been used in the context of overdose. If you look at the graphs of overdose in the state of Florida, I already described the transition to street heroin, fentanyl, the overdose deaths surged in the entire state. But then you see in 2017 and 2018, there's one county where the overdose deaths start to turn down. They start to finally decrease. And that's Miami-Dade County. And that's because we were able to saturate the streets with naloxone. I mean, it's never enough. We continue to increase our distribution. But that was very salient to the legislators when we were trying to get the expansion program. They could see and understand that giving people the tools to save each other's lives was an effective intervention. The other huge success of IDEA, very early success, was we do routine HIV and hepatitis C testing because people who inject drugs are at very high risk for both of these diseases. We uncovered a cluster of new HIV infections. These days, everybody knows about contact tracing and things like and how you investigate an outbreak. Mm-hmm. But back then, we had to do contact tracing amongst a community that doesn't really trust institutions. We had to forge a pathway to enter HIV care for people who were homeless, living under a bridge, and injecting cocaine and fentanyl every day. However, we were successful in our partnership with the Department of Health in making a clear pathway to treatment, and we were able to end the outbreak before it started. We were also able to convey that message to the legislature when we went back. They understood that with routine testing, you would be able to detect and control outbreaks before they started. And it was with all of that evidence that we were able to get the expansion bill passed in just 2 years. And as you know, Tim, in 2019, we passed the expansion bill making needle exchange legal in the entire state.
Yeah, and I did not think that was possible. And you've proven me wrong on so many occasions where I thought, this is probably not doable, and you got it done. So tell me a little bit about that. Now that you've had great success in Miami-Dade, and I understand other counties in Florida, such as Palm Beach County, are looking to establish similar harm reduction initiatives. Tell me a little bit, and I know there's others, and you can inform us on what other counties are looking at pursuing harm reduction initiatives. But particularly Palm Beach County and others, have they reached out to you, and have you been involved in helping bring this to other communities around the state?
Absolutely. So just to take a step back, so when we worked to advocate for the initial legislation, I was a student and then a resident at Jackson Memorial Hospital. The amazing thing about pushing the expansion was I was a faculty member mentoring students from the medical schools across the state in how to effectively advocate for legislation. So it was really full circle, and it was one of the. I just remember going into the offices of the legislators, and I have to admit they were. I have a lot of experience in the Capitol now, so they became a little bit less eager to hear from me, and just watching the students enthusiastically explain the importance of this program was a beautiful thing. So now we have authorized needle exchange in the state of Florida. I believe 8 counties have passed legislation in order to start to implement programs. And IDEA Tampa at University of South Florida, in partnership with Tampa General Hospital, opened Monday this week.
Wow.
So that is going now.
Congratulations.
And we're very
Wow.
excited about that, and we've helped them as they've tried to implement their program, the testing, and all of the ancillary services. Because the needle exchange is the easy part. It's really all of the comprehensive healthcare that is more challenging. Palm Beach County, my home county, as you know, Tim, has opened Flash Exchange, which is very exciting. And all of these new programs, we not only help them set up their policies and procedures by sharing hours with them. We have held trainings in partnership with the Florida Department of Health for these new programs. We have sent large donations of supplies to these programs to help them get off of their feet. And it's very exciting. So I think Broward will actually, Leon County, the capital, Tallahassee might be next.
Wow.
Broward or Orange County. They're all moving very, very quickly. Of course, the pandemic slowed things down.
Sure.
But things are going again. And it's even more important in the pandemic because we've all seen the new CDC data. With the pandemic has come profound despair, economic hardship, and a lot of substance use. And so many of my patients who had been in recovery for years, taking medication to help control their cravings, if they worked in a restaurant, they lost their job. Restaurants were closed in this city for months. So there's been a lot of people who have unfortunately needed our services again. And we've seen from the CDC that overdose deaths have surged nationwide and in Florida during the pandemic. And this is expected. So the work is even more important now than ever as we recover from the COVID pandemic.
Yeah, absolutely. And that was going to be my next question. I was going to ask you how the pandemic has impacted the population that you're serving. Obviously, it's affected everybody, but disproportionately, it's affected probably people that you have interacted with and worked with and have been beneficiaries of the IDEA exchange. So can you go a little bit more? Give us a little bit more about just the challenges that have come up over the past year as you've not only sought to sustain your program in Miami, but also expand the program into other communities around the state.
I mean, in terms of expansion, it just put plans on pause. The county commissions they didn't have the capacity to deal with implementation of public health programs outside of the COVID pandemic. That was right. All of the bandwidth was being used there. In terms of our program in general, the impact has been devastating. As you know, Tim, I like Twitter, as you do. So I saw this coming from January and February. It was seeing things happen in Asia on Twitter, then seeing the academics in healthcare in Europe. That was when I knew it was coming. That's when there was no doubt that we were about to get hammered with this pandemic. So we had warnings. Very early on, we changed our procedures at IDEA to not only protect our staff, but also protect our participants. So prior to mask recommendations in Miami-Dade County, my staff was wearing N95s because we saw this coming. We stopped having face-to-face contact with our participants. So they no longer go inside at the exchange. We kept everybody outside because, as we know, coronavirus does not transmit the same way outside. In addition to distributing syringes and naloxone, we also distribute masks now because that is a major public health intervention.
Yeah.
We distribute food because a lot of the people, the charitable people in Miami who were feeding people who were homeless no longer went out. Everybody was scared. So we had to pivot into roles that we didn't anticipate. Unfortunately, as we gathered our PPE and gathered and formulated our new procedures, we halted HIV and hepatitis C testing for a period. And I was very concerned about the possibility of silent outbreaks that were not being detected during that time. I think that the biggest thing about harm reduction that I'd like for people to know is that people who are perhaps homeless and injecting drugs are treated terribly by society, from the healthcare system to just in every facet of society. And the biggest thing about our program is it instills humanity in them, respect and dignity. And so, unfortunately, with the pandemic, that smile from my staff is gone. They can't see that smile anymore. There's no more hugs. I can't tell you how many packages, care packages we'll call them, come with a hug, and all of that has ended. So it's very sad, the new face, but we pivoted in other ways that are really exciting. So telehealth, Tim, teleharm reduction. We're doing HIV care in the field now, hepatitis C care, medications for opioid use disorder, so treatment for addiction. My students came to me and said, how can we help the people who use IDEA during the pandemic? And they had been pulled from clinical duties, and we implemented a pretty robust telehealth system. So we're pivoting to the new era and trying to now deliver teleharm reduction to our participants, but things look different. Things have changed for sure.
You use the word humanity, and I can't think of a better word that really describes, and it's really the essence of that doctor-patient relationship. When you think about the famous picture, the Norman Rockwell painting of the doctor by the bedside treating the patient, that's really the essence of your program, and it's the essence of medicine. And so we talked a little bit about the FMA's involvement, and that was a new thing for FMA to be engaged in a public health initiative that has the scope and scale of what you're doing. One of the compromises, I guess, that was made in order to get this going was that there's no public funding of the harm reduction program. So tell us a little bit about, and maybe someday that will change. I think certainly, we're in the middle of a pandemic, and I think there's heightened awareness now of the importance of intervention and contact tracing and all the things that you were doing before COVID. Tell us how the program is funded, and who have been some of the heroes that have sort of stepped up and really helped you in that regard.
Well, Tim, I'm going to talk to you about funding, and it is complex, but I have to go back. So the FMA basically is the organization that taught me how to write legislation, to advocate for legislation, and how to pass a bill. It was an experiential process. I was an intern with you all, and I've been able to pass that knowledge on to countless medical students at this time. It's really an educational experience that is just profound, and I'm so appreciative of it.
Well, and it's benefited the FMA as well. I mean, that's sort of one of the secondary benefits. Obviously, the program and the people that you're helping are the primary, beneficiaries, certainly. But the organization has benefited in ways that we could have never have imagined. Thanks to your mentorship and everything, and that's really a legacy to be proud of.
Well, thank you, Tim. It's the FMA got out there on this public health issue. And really, I have to say this, the FMA had to lead on this issue because the government was failing in the way that it was addressing the overdose crisis. It was not appropriately addressing the root causes and advocating for interventions that save lives. And the FMA had to step up. And I hope that that was a precursor to what happened in 2020. The state was again failing on encouraging mask use. We know that wearing masks prevents transmission of coronavirus. In the absence, in the vacuum of leadership from the state, the FMA had to step up once again and go on an educational campaign to tell people about the importance of mask wearing. I hope that there was some precedent in the work that we did in encouraging the Florida Medical Association to go into the realm of public health, because it is so powerful. The PSAs and the campaign that the FMA launched was and is greatly needed, and that's the power of the organization to do things beyond the day to day, to really have an impact on helping the community. You wanted to talk about funding.
Yeah, funding. Tell us about funding, because I know it's complicated. And so tell us a little bit about that.
Yeah. So it is very complicated. And unfortunately, in the pilot legislation, there was a prohibition on state and municipal funding. So we had to write grants and ask for private philanthropy. We have amazing private champions such as Joy Fishman, whose husband, Jack Fishman, actually invented naloxone. Tragically, her son died of an opioid overdose in the early 2000s. Jonathan passed away in Miami, and she is one of our co-founders of IDEA and has been a huge financial supporter, as well as somebody who hands out sandwiches and syringes with our program. So she not only writes checks, but she does the hard work as well. The national HIV service organizations, such as Elton John AIDS Foundation, MAC AIDS Foundation, MAC Cosmetics, Gilead, they were all very eager to fund our program, because if the Miami program showed immediate success, we were going to be able to expand to the whole state. And so there was a lot of focus on our program and ensuring its success, because Florida is the third largest state and we have very high rates of HIV. And I'm happy and grateful for all of the initial investment, private investment, because it really did allow us to very quickly show the legislature the value of our program. Now, in terms of public support, the distribution of naloxone is actually a state-funded initiative. The naloxone is purchased by the state, and we act on behalf of the state in the distribution of the life-saving drug. Our HIV care that we provide on site at IDEA is also funded by state Ryan White. We've really partitioned the core function of handing out needles from all of the valuable wraparound services. So we do get public funding for all of the valuable wraparound services. And it really came from the fact that when there was the outbreak in 2018, the state realized how much they needed us. How could the state do contact tracing in this community without us? It would not have been possible. They found people that they had been looking for years when they started to come out on the van with us. So we've really found a way to partner with public entities, now with the Department of Children and Families for writing prescriptions and paying for treatment, the medications that treat opioid use disorder. So it's a complex private-public partnership. The public is funding more of the medical side, and the private is funding the core harm reduction services. But it's really because the local government has seen the value in our program and the fact that it's essential in securing the public health.
And let's not forget, the University of Miami and the support that you've gotten from the president on down. You are in a place that really, the perfect place, really, that's embraced your work and has been very supportive. So tell us a little bit about the University of Miami, the president, the medical school and all of that, because I don't think this would have been possible without having that institution there supporting you, right?
Oh my gosh, Tim. I mean, the support from my institution is just amazing. I mean, it helps that President Frank was the Minister of Health in Mexico and the former Dean of the School of Public Health at Harvard. He believes in these programs. We've had a series of deans from Dean Goldschmidt when I was a medical student to Dean Ford now that have been ardent proponents of harm reduction. The university went so far. I mean, not only allowing me to miss some school when I was a medical student, you knew I had to have been missing some school, Tim. I was in Tallahassee.
A little bit, right? We wondered about that a few times.
The university saw the importance of the work that I was doing and actually allowed for me to miss that school because they knew the impact that this program would have. Same thing when I was a resident at Jackson. I missed some time working in the hospital, but it was because of the support from Jackson Health System and they're seeing the importance of this work. The support from the university actually went further. When I joined faculty, they protected 50% of my faculty time so that I could administer the program, evaluate the program, teach advocacy amongst the medical students. And really now we're teaching a comprehensive harm reduction curriculum. I've been charged with teaching the students about addiction and the ways that we can treat it, which has been fantastic. But as you know, Tim, you've been to the ID Exchange. That lot, the university owns that lot. That's land in the city of Miami. It's very expensive and very high.
Sure.
Land. And the university just gave it to us to open the program. So I'm very thankful to the University of Miami, and it's really exciting seeing the involvement of the other medical schools in the state in the new programs. USF, Dean Lockwood, who serves on the board of the Florida Medical Association. His support of the program out in Tampa is why Tampa was the next program to open. So the medical schools play a large role in the rollout of these programs.
So I know because I'm on social media, as you mentioned, that as a frontline physician, you recently received your second dose of the COVID vaccine. So speaking as a physician a public health physician, tell us about your personal experience with the vaccine and what's your message to the public about the importance of getting the vaccine.
Yeah, absolutely. So I'm 9 days out from my second dose of the Pfizer COVID vaccine. I was one of the initial group of physicians who was vaccinated in a very public manner at Jackson Memorial Hospital. And that was important to me because I have been a public health leader in our community and in our state. And I wanted patients, staff, employees, I wanted people to see me getting the vaccine and to see that I trusted in the science and trusted in the vaccine. I wanted to lead by example. So after the first shot, the only side effect was arm pain, just like, say, a tetanus shot. So it wasn't too bad. And I was able to document the side effects and share it, share that with my story with the community. After the second shot, 21 days later, I had the arm pain again. I will say that I got the shot a little bit before noon. By the time I went home that evening, I was very fatigued. I was very, very tired. And so the next morning when I woke up, I had a large cup of Miami dark coffee and the fatigue resolved. And
best coffee in the world, by the way.
Now I have confirmed actually yesterday that I do have COVID antibodies. So I am immune to COVID without having ever had coronavirus. So really exciting. I'm sharing that. I actually went from my second vaccine to filming to do PSAs in minority communities to encourage minority communities to get the COVID vaccine. There's a lot of distrust. And the distrust is grounded in experience.
Yes.
We have to acknowledge the reasons for distrust in the community, but then take the time to explain the science, explain the importance of vaccination. And that's really one of my major goals in 2021 is making sure that there's uptake of the vaccine in minority communities.
Well, that fits very nicely with one of the FMA's goals. And you mentioned our public service announcements and how we've really used all of our communication platforms, social media platforms to promote mask use. And now we're pivoting towards the flu vaccine. And we've used your image and the image of several other physicians who have gotten the vaccine to really show the public that it's safe and that the physicians trust the science. So that's going to be really important over the next year. We need to make sure that everybody gets the vaccine if we want to move on with our lives and get back to some sense of normal. That's it's the critical component of that. So the last question I have for you, and we've touched on this, but you've been involved in organized medicine as a member of the board of the FMA. So you've seen, firsthand the, what physicians coming together, working together, what you can achieve. And you've been a mentor to the medical students and residents around the state. What's your message for physicians about the importance of being involved with the FMA, and at the very least, being a member of the FMA?
So, Tim, I really do wish I were still with you on the board. It's in 2020, being pregnant in a pandemic and having a baby was something else.
Yeah.
So working two full-time professional parents and having a newborn is challenging. And she's here. I don't know if any of her crying, asking for food will make it into the broadcast, but there were challenges, and I cannot wait to return to the board when we are through the pandemic. It's very interesting. So it was definitely challenging to pass the resolution back in 2012 to get the FMA involved in such work that some view, especially 10 years ago, viewed more as controversial, less so now. But the way that the organization came together, and then, as you know, Tim, when we brought this legislation to the Capitol, they rarely do bills like this pass with such little dissent. I mean,
right.
The expansion bill, of the 160 people in the legislature, there were only 2 no votes. I mean, that is amazing. So probably the last time D's and R's came together. So I do just want to say there is hope for collaboration for a better world. And I hope that we move out of this hyper partisan age that we live in now, because it's harmful to all of us, and it really is dragging everybody. And I think that the biggest thing about organized medicine, and it's interesting for me to say now because I do have a platform and I do have a voice, but working with the FMA is how I learned to effectively use that voice to advocate for my patients, to advocate for the community, to ensure that we're able to offer the best medical care and the best public health for people in the state of Florida. So the amount that I've learned, working the Capitol on student and resident legislative visit days, there's so much that we learn on the medical side, and medicine is 2020 sure shows us that medicine is always evolving, but the being on the other side, the side of working with legislatures to streamline the way that we deliver care, to protect the health of our patients, has been an invaluable experience. So I really recommend to all of our students, our residents, and all of my fellow physicians to be involved with organized medicine, because you have a voice and the FMA can teach you how to more effectively use it. And if we've seen anything in 2020, it's that physicians are now in the front. We are on the news every single day, effectively communicating public health messages, effectively describing what is happening, how the vaccines work, how the virus is transmission. I think that organized medicine is more important now than it ever has been, because we really are the leaders and we are the only way out. And it is going to be a couple of years until we get back to that way we used to live.
Well, thank you for saying that, and certainly physicians are stronger when they're together, when they're unified and they're speaking with one voice, and hopefully the FMA provides that voice, at least for physicians in Florida. Well, thank you, so much. You really have been generous with your time today. The FMA, Dr. Tookes, is so proud to have you as a member. And we benefit greatly from your involvement in the organization. This is just the beginning of, I hope, a lifelong partnership, if you will, between you and the FMA, and your involvement in organized medicine is really important. And right now, you've earned a well-deserved break, and you are enjoying having a baby and building your family and so forth. And so we'll cut you some slack for now, but at some point we want you back on the board of the Florida Medical Association. You bring so much to the table, and again, thank you for joining us today. I really appreciate the update on the needle exchange program and your perspective on the COVID vaccine. Look forward, when we're able to get together in person, look forward to seeing you soon.
I appreciate it, Tim. And thanks to the FMA for my CME. I just renewed my license.
Awesome. Well, there's another benefit to FMA membership. You can get your CME very conveniently, and we even report it to CE Broker. Thank you. That is a great advertisement for our CME, and again, that's another benefit of being a member of the FMA. So, thanks again, my friend. Look forward to seeing you soon.
You too, Tim.
All right. Take care.
Florida Medical Association, helping physicians practice medicine.